Hello, everyone, and greetings from the United States and from Boston. I'm Kathy Jenkins, and I'm sorry I'm not able to be with you today, but I'm very pleased that I'm able to give you an update on the International Quality Improvement Collaborative for Congenital Heart Disease, a project that we started a number of years ago, launched at one of the prior Global Forum in Humanitarian Medicine meetings. I have no disclosures. I do think, though, that it's very important to start by just really understanding the magnitude of inequities in care for congenital heart disease around the world. And at this moment in time, 9 out of 10 people who are born with congenital heart disease do not have access to high quality, life saving treatment for their disease. And so death and disability from congenital heart disease is much greater in low and middle income countries than it is in higher income countries. For a long time, we didn't really have good data to support what I just said, but that changed because of the global burden of disease studies. And Megan Zimmerman and Gerard Martin and others from Children's National really worked with the GBD to be able to make the database appropriate and better for looking at congenital heart anomalies. And now other researchers can use that database really to show what is going on around the world for congenital heart disease. And this is just a picture, a global picture of the state of the world in 2019, showing differences in age standardized disability adjusted life year rates around the world. And suffice it to say that the blue areas have lower death and disability, and the red and yellow areas have more. And you can see just by looking at the map that there is inequitable care for congenital heart disease. And this results both from where babies are born and from where there are access to high quality surgical programs. And just another fact that I find disturbing is that we all know that care for congenital heart disease is getting better. Things seem to be getting better all the time. Mortality rates are generally dropping, but that improvement is also not equal around the world. And this is just a study that was done by Sue et al. From the Global Burden of Disease um, databases, and it showed this amazing improvement in mortality overall between 1990 and 2019, but also showed that the incredible drop and improvement in mortality was much steeper and much faster in high income countries than it was in low income countries. And so, although everything is getting better, the inequities in care are actually getting worse. So it's this problem that led us to start the International Quality Improvement Collaborative for Congenital Heart Disease. It's often known as IQIC. Many people refer to the project that way. And IQIC has a vision to create a collaborative of healthcare teams all around the world to create a culture of safety and quality of care for CHD with an overall mission to reduce mortality and major complications. And the focus of the project is on care in low and middle income countries. Now, this idea of doing a quality improvement collaborative was actually founded by the Institute of Healthcare Improvement, a very large quality organization in the United States, who thought of this plan that teams could actually all work together to improve care delivery around a common problem that they were all struggling with, and they could learn from each other and make better progress together than they could separately. And I'll just say that there are a number of pretty prominent quality improvement collaboratives going on right now in the United States. And one I would just highlight that I was helped set up a number of years ago was called the National Pediatric Cardiology Quality Improvement Collaborative, and it was focused on single ventricles and is based in Cincinnati. in the United States. We have a number of major NGO partners that are also aligned with our work. One is Children's HeartLink, which I'm sure you'll hear about at this conference, which is a major NGO in the United States based in Minnesota that's been focused for more than 50 years on improving care for people with congenital heart disease around the world. Bill Novick and his Cardiac Alliance is also a prominent partner. We met Dr. Novick here at the Global Forum years ago and are still working with him. And the new kid on the block is Global Arch. For those of you that haven't heard about it yet, Global Arch is an alliance of the parent and patient advocacy organizations around the world who are all aligning their efforts and working together to really do a better job of advocating for congenital heart care wherever it is that they live. And of course, the Global Forum, as I said, we're all here today at the Global Forum, but IQIC was launched at a Global Forum meeting a number of years ago and is still very much aligned with the work of the Global Forum. So this is the map from 2024 of where the sites are around the world that are part of IQIC. We launched a catheterization registry a few years ago. The first registry was a surgical registry. And so some of the institutions participate in one and some participate in both. But this is what the map looks like. And I will say that we started with a few pilot sites a long time ago now in 2008, but the program has grown organically based on where people are interested in joining and participating. And when we first started IQIC, one of the problems that was highlighted at the Global Forum meeting at the time was that there was very little data about what was going on around the world, what types of surgeries were happening, what kinds of cases were getting operated on, and what the outcomes looked like, how those cases were going. That is not true anymore. As of very recently, we have data in our registry for almost 200,000 cases of congenital heart surgery operated on in the participants of IQIC from low and middle income countries. And we launched the catheterization registry a few years ago, and we now have 28,000 or more than 28,000 cases of catheterizations being done for congenital heart disease in pediatric cath labs around the world. So that registry data is used to help programs understand their outcomes and how they're doing. And so each year, the programs receive a benchmarking report. Many of you, if you are part of IQIC and you're here today at the conference, have received a benchmarking report. And what that shows is how your case mix compares to other centers that are part of IQIC, how your outcomes compare, and then how your risk-adjusted mortality and infection rates compare to other centers that are part of IQIC. And centers can use that data to understand how they're doing and understand how to improve their program. And this is just a slide to say that the quality improvement part of the project is in no way, the registry is based in Boston, but the actual improvement work is done in the local programs all around the world. And this is just a slide with pictures of a number of the teams that's meant to just make that really clear. And one of the things that we've done in IQIC is to really teach and introduce some really fundamental tools to do quality improvement. One of the important tools that we use, which is also one of my favorite tools because I'm a big picture person, is something called the key driver diagram. And that's really laying out for any quality improvement project, sort of what you're trying to do and how you're trying to do it. Key driver diagrams have an aim statement about what you're trying to accomplish. And for our project, our aim is very clear. It's to reduce mortality for congenital heart disease. And the middle part really talks about the key drivers, what it is that the project focuses on to improve care. And in IQIC for the surgical registry, we focus on safe perioperative practice, which is really a lot about um, the team-based practice and handoffs between the operating room and the ICU to really assure there's complete communication between the different teams that will be taking care of a patient. And our project is also very focused on reducing infections, particularly bacterial sepsis and surgical site infections. And just to say that if a child has a serious infection after congenital heart surgery, they have about a fourfold higher likelihood of dying. So reducing infections is a major focus for the project. And the last key driver is on team-based practice. And the focus there is really not so much on the physician practice, but on all the other team members, especially the nurses at the bedside, in the ICU, the cath lab technicians, people like that, who are really important members of the care delivery team and really can benefit from greater education and empowerment, especially in low and middle income countries. So these are the main three drivers for the IQIC quality improvement work around team communication, infection reduction, and empowering nurses and the other care providers to do their job at the highest level. And this is just a picture of some of the efforts to reduce infections. We all know that hand hygiene is actually the most fundamental change that often isn't completely adopted in many healthcare settings. And so this is just a picture of a poster on the wall in a program in Guatemala, the one that Aldo Castaneda started in Guatemala City at UNICAR, showing the 5 moments of hand hygiene to remind everyone in the unit about the importance of hand hygiene to reduce infection. And this slide actually shows a number of the surgical safety checklists that were introduced by IQIC. The WHO actually, when we started the project, had just announced, based on Atul Gawande's work, that every operating room in the world should use a surgical safety checklist. And so we introduced the surgical safety checklists into IQIC. And this is just some examples of ones that have been put in place at different participating programs. We also have collected the data, as I showed you. We now have almost 200,000 cases in the registry, and that data has been able to be leveraged for a whole variety of important purposes, one of which is research, just really looking a little bit more deeply on the care delivery in low and middle income countries. This is a paper that was done a few years ago. The lead author was Nestor Sandoval, who is a member of our steering committee from Bogota, Colombia. And he looked at almost 3,000 cases 2,000 cases of tetralogy of Fallot being operated on low and middle income countries. And he was able to show that at that time, the overall mortality rate was about 3.3% in low and middle income countries, whereas at that time, it was about 1.3 and 2.5% in the United States and in Europe. So the outcomes were higher in low and middle income countries, but the magnitude of the difference was actually really not that great. And there'll be a newer paper looking at more recent outcomes for tetralogy of Fallot and be probably within the next year. And we're also able to use the data to just highlight certain issues that are really important problems facing surgeons in low and middle income countries. This is a picture of Rachel Wittenberg. She was a medical student at Harvard at the time with an interest in global health. She's now in her internship at Mass General Hospital hoping to be a cardiologist. But she looked at preoperative malnutrition, and she was able to look at the way outcomes differed for ventricular septal defect closure based on malnutrition. And she had, more than 10,000 cases that she was able to analyze. And no one who operates in the low and middle income countries will be surprised at just how incredibly prevalent and burdensome malnutrition is. I think it was more than almost 40% or more of the cohort was operated on with really significant malnutrition at the time of their surgery. And so the data that we get in IQIC can also just highlight these important issues and also the magnitude of the problem. And no one will be surprised that the patients who had extreme malnutrition had much worse outcomes than patients who had better nutrition in this analysis. Now, we've also been able to just look overall at how outcomes have changed in the entire program. And this is just a slide showing that. We actually have used the RACS model, the risk adjustment for congenital heart surgery model in this project. And this just shows if you apply the model using a model that was developed between 2016 and 2020 to the whole project, how mortality, standardized risk adjusted mortality has actually dropped and more recently plateaued in the entire cohort. So I'm just going to highlight on the next slide some of the new and upcoming priorities for the overall project. So one of the things we've launched over the past year, we've always had a very strong emphasis on nursing and educating and empowering nurses to elevate their practice as a part of IQIC. But over the past year, we've actually launched a new nursing steering committee, and it's chaired by Anna Fisk, who some of you may know, who actually has been a volunteer for Children's HeartLink. She's been a part of IQIC for many years. But it has a broader representation of nurses and nurse leaders from IQIC sites around the world. And this group of nurse and leaders has been really getting more involved with some of the aspects of IQIC that are especially pertinent to nursing practice. They've been looking very carefully at nutrition management during and around the cardiac surgical episode. And there'll be some educational webinars about their conclusions and recommendations very soon. They've actually just been looking in general at the nursing webinar curriculum to tailor it to be as the focused on the things that are the most important to nursing practice. They are looking at introducing some nurse-sensitive measures into the IQIC database so that can be more of a focused look at nursing practice around the world. And there's also going to be an upcoming leadership series. Jason Thornton at Boston Children's is also involved with this, along with Patty Hickey, on bringing together the nursing leaders at the IQIC sites around the world to talk about issues that they all face. And the first topic of interest is going to be about creating and maintaining a healthy work environment for the nurses, the cardiac nurses around the world. We also have, we've had a cardiac catheterization steering committee since we launched the database a few years ago. But it's been enhanced with members over the past year. Babar Hassan in Pakistan has been chairing the committee, but there are now representatives from multiple countries around the world. And from the United States, Brian Quinn, who runs a US-based cardiac catheterization registry called C3PO. It was started by my friend and colleague, Lisa Bergerson, And Brian is part of the IQIC catheterization steering committee because there's a very much an intentionality of keeping an alignment between the United States C3PO QI project for cardiac catheterization and the IQIC catheterization steering committee activities. And so this group has been focused on the webinar curriculum. They've also been looking carefully at the database. There's a lot more difficulty with some of the data entry related to the cardiac catheterization data, and they want to streamline that if they can. And they've also been really very active. The data coming out of the catheterization registry is some of the newest information around, especially from low and middle income countries. And so they're very academically active and have really launched a number of different research papers related to doing cardiac catheterization in low and middle income countries. And we've also really been able over the past year to now post-COVID and all of that to really enhance the webinar series. Any of you who are part of the project may have noticed that, but this is just one slide that's an example of that, where there had been a call and a request to do more, particularly around ECMO. And so there was a 4-part series done this year. One of them was about anticoagulation, and it was led by Dot Becky and Ravi Thiagarajan in Boston, who have been very integral both in IQIC and in our ECMO program. And Ravi particularly has been a leader of the ELSA registry and other programs like that related to pediatric ECMO. And so we were able to introduce an enhanced webinar series related to ECMO. And we're also going to be having some new ECMO educational programming coming up soon, and likely also an QI project specific to pediatric ECMO. Another thing that we've been working on intensively over the past year is a new risk adjustment model. And so the model that we've been using, RAX1, was designed a number of years ago. I was part of the founding of RAX1. We've actually been applying it with more recent data, so it's not terribly outdated in the way we've been using it. But many people have noted that the case mix in low and middle income countries facing surgeons in many parts of the world are just very different than they are in the United States or Europe. And so we wanted to be sure to incorporate some of that additional, risk factor modeling into the project. And so we've had a group that's been meeting almost for the last 6 or 9 months to revise RAX1 and to use the data from IQIC, as the basis for making decisions about what risk factors should be included. I can tell you for sure that there's going to be still be 6 categories, but that many of the procedures may move categories, and that there'll be some additional new variables in thinking in this model. I actually, I'm an artist. I make monotypes, which are a type of printmaking technique. So just to depict this, I actually have this picture of a butterfly flying out of a cave that's called Emergence in my office that I did a few years ago. So I just hope the butterfly comes out of the cave and that we're actually able to launch the new model that's specific for low and middle income countries very soon. We're also going to be starting a new project in Pakistan in 2026. It's being funded by the H.M. Habib Cardiac Endowment. And the idea is that what we really want to do is to have local leaders and local programs start to align their own efforts to improve care where in their own country. And so we are going to be generating some Pakistan-specific reports using the IQIC data and assisting the sites in Pakistan who are, who choose to be part of the project with doing some Pakistani-wide quality improvement projects that are really focused on, some of the particular needs of this particular country. And so I'm really excited about this, and it is something that we would be able to replicate in other locations around the world, and we're expecting that it will start in 2026. Uh, Also, just around the corner is the 9th World Congress for Pediatric Cardiology and Cardiac Surgery. It's going to be this December in Hong Kong. If any of you are there, we are going to be having a pre-conference session on the day before the meetings after actually begin. And we're doing that session in conjunction with the new educational program called Empowering Hearts Globally, which is being led by Wyman Lai from California in the United States, who's done a lot of work in the past in Vietnam. And so both of our groups are going to be meeting together for the pre-conference, and we'll be having a learning session about many of the things I just told you about and other new things going on in IQIC. We're also going to be showcasing the new RACS model for low and middle income countries. Um, and we're just to say, for those of you who are not able to go to Hong Kong, we know many people are not able to attend that conference for a variety of reasons. We're also planning the next session that will be focused on Latin America in Bogota in 2027. And just to say that, at the time that we started this, we really didn't have a lot of data or information about what was going on globally in low and middle income countries. That's not the case anymore, as I've shown you. And just to say that that data can be very useful in global advocacy to improve the resources we have for congenital heart disease and the focus on getting what we need to reduce global inequities. And many of you may know that Children's HeartLink, created the Case for the Invisible Child series a few years ago. The blueprint that they created was also embodied in a call to action document at the last World Congress and is now the basis for a WHO resolution that many people are hoping will pass potentially in 2026 or 2027. And I'm sure you may hear more about that at the conference. But I'm very glad that the data that we have and the successes we've had in IQIC might actually help those efforts be successful and, create the story with data that may be helpful or needed for that. And as I said before, our project was launched at the Global Forum meetings. I'm extremely thrilled to be able to share this update with you today. And I hope you all have a wonderful and impactful conference.